The benefits of the flu vaccine. It's that time of year again. Shipments of the flu vaccine are arriving in hospitals and doctors' offices. Getting the flu vaccine is the best way that you can protect yourself from the nasty virus. Influenza is a respiratory infection that could possibly cause serious complications and even death. The Mayo Clinic staff, in their article Flu Shot, Your Best Bet for Avoiding Influenza, writes that the Center for Disease Control recommends that everyone 6 months of age and older be vaccinated annually against influenza. One of the benefits of getting the flu vaccine is that you could avoid getting the flu. The flu vaccine prevents millions of illnesses and doctors' visits related to the flu yearly. According to the CDC, during the 2016-2017 flu season, the flu vaccination prevented an estimated 5.3 million influenza illnesses, 2.6 million influenza-related medical visits, and 85,000 influenza-associated hospitalizations. These statistics were from just 1 year. The flu vaccine prevents tens of thousands of hospitalizations each year. In seasons where the viruses in the vaccines match the circulating virus, the vaccine reduced flu-related doctor's visits by 40 to 60%. A 2018 study, according to the Mayo Clinic, showed that from 2012 to 2015, flu vaccination among adults reduced the risk of being admitted to an intensive care unit with flu by 82%. That's quite impressive. The influenza vaccine is an important preventative tool for those people with chronic illnesses. In those people with heart disease, being vaccinated lowered the rates of some cardiac events and reduced hospitalization rates of those with diabetes. Another benefit listed by the CDC is that the flu vaccine reduces the severity of the illness in those who do contract it. A 2018 CDC study published in Vaccine Magazine showed that among adults hospitalized with the flu, those patients that were vaccinated were 82% less likely to wind up in an intensive care unit, and that the patients who did receive the vaccine were hospitalized spent 4 fewer days in the hospital. This study was conducted over 4 flu seasons from 2012 to 2015. While healthcare professionals advise everyone 6 months of age and older to get the flu vaccine, there are some individuals who should not get the flu vaccine. The Mayo Clinic advises to check with your doctor before getting a flu vaccine if you are allergic to eggs. They go on to say if your allergy is mild, for example, if you get hives from eggs, no additional precautions need to be taken when getting the vaccine. But if your egg allergy is severe, you need to be vaccinated in a medical setting with a doctor present. The flu vaccine is not recommended for anyone who has a severe reaction to the vaccine. Before you decide not to take the vaccination, check with your doctor. Some reactions could be from something other than the vaccine itself. Vaccine delivery options include the injection or nasal spray. Some ways to reduce the risk of flu if you decide not to get vaccinated include washing your hands every chance you get. Avoid crowds if at all possible, and practice good health habits like getting enough rest and eating right. Most importantly, stay home if you are sick. I know it's not always possible. No one else wants your germs. There are many people who are opposed to the flu vaccine. I, for one, have to get it as I work for a hospital, and we do not want to spread any illness to our patients. There are also those who think that they never get sick, so there is not a need for them to get vaccinated. Influenza is a very serious illness which could possibly lead to hospitalization or death. I've given you some facts on why you should get vaccinated. Do it for yourself and others around you. The flu vaccine is about protecting yourself against the virus. It also prevents you from transmitting the virus to others who may be vulnerable. Those who are vulnerable, according to WebMD, include the elderly, children, and the immunocompromised. Flu season is right around the corner, and prevention is the key.